Okay, I want to thank everybody for taking time this morning to talk about fibromyalgia. Sherry and I discussed why we needed to have an in-service and talk about fibromyalgia, and it's because generally when our patients come in and tell us that they've been diagnosed with that, we typically want to roll our eyes and we think this person is a hypochondriac. But it's a real diagnosis, and we need to familiarize ourselves with the symptoms and the treatment. The United States National Library of Medicine states that fibromyalgia is a chronic syndrome of widespread pain and tenderness in the joints, muscles, tendons, and soft tissue. Associated symptoms are fatigue, sleep disturbance, headaches, depression, and anxiety. And you can see how this can create a cycle of pain-causing symptoms causing more pain. Diagnosis is by positive tender points in 11 of 18 areas. So there's no blood test, no imaging that's going to confirm a diagnosis for us. And it's common in women ages 20 to 50, so that takes care of all of us in this in-service. It could be any of us. It's a frustrating illness, and many of these patients feel alone and misunderstood. The United States National Library of Medicine reports that common triggers are physical or emotional trauma, sleep disturbance, viral infection, and abnormal pain response. And I found an article from 2011 by Kindler, Bennett, and Jones about central sensitivity syndrome, stating that fibromyalgia is a disorder of pain receptor processing. They found that there's a lower threshold to recognize pain in patients with fibromyalgia, and there are abnormalities in the neural pathway, both ascending and descending. Other disorders that they found that are linked to this abnormal pain response are temporomandibular disorder, irritable bowel syndrome, interstitial cystitis, headaches, chronic low back pain, and chronic neck pain. So more research is needed on these diagnoses. These are other diagnoses that you can't, it's subjective information. So there's not a test that's just going to absolutely confirm this diagnosis. The United States National Library of Medicine reports symptoms of fibromyalgia as tender points of the soft tissue on the back of the neck, shoulders, chest, low back, hips, shins, elbows, and knees. Pain can be exacerbated with anxiety and stress. Other symptoms are fatigue, depression, difficulty sleeping and concentrating, and poor memory. Also tension headaches. I ran across a study about patients' perceptions of care in 2008 from the Journal of Nursing and Healthcare of Chronic Illnesses. And it's about recommendations for healthcare providers. There was an online questionnaire sent to 209 fibromyalgia patients in a support group, and 42 people responded, and the authors ranked the top 5 responses. Number 1 was listening to the patient. Don't ignore their complaints. Don't rush them through to talk about other problems. Don't belittle them by saying that it's not a real diagnosis. There are limited treatments for fibromyalgia, and these patients responded that they felt this improved their care if you listen, because it provided them with some emotional support. Number 2 is to educate yourself as a healthcare provider about fibromyalgia. Know the latest research and treatments. We're in an era of evidence-based practice, and we have a responsibility to remain up to date on research and treatments. Number 3 was to be supportive. They used words like empathetic and compassion, and they associated those words and responses from healthcare providers with positive experiences. Number 4, take patients seriously and don't underestimate their pain. The result of that, by their response, was that they perceived their treatment was inadequate. And then also be available to discuss alternative treatments. The goal of treatment is going to be to alleviate symptoms and improve their coping skills. There are medical treatments, medication, then there are non-pharmacological treatments. For medicines, approved medications would be Cymbalta, Lyrica, and Savella. And then we may see some adjuvant therapy used like anti-seizure medication, muscle relaxers, pain relievers, and sleep aids. Also, we need to encourage these patients to exercise. A routine fitness program can improve their symptoms, plus we all know the benefits of the emotional component of exercise on our mood. And then stress relief measures such as light massage and relaxation techniques. We also need to work with our patients on cognitive behavioral therapy, redirecting their negative thoughts. If they tell you, they wanted to go do something for 4 hours one day and they were only able to maybe do 30 minutes to an hour, they need to focus on the positive aspect of being able to do that activity for the time they could and not focus on the fact that they couldn't do it for the length that they wanted. They need to recognize their aggravating factors and try to avoid or limit those activities. We need to encourage them to engage in enjoyable activities, and then also to set limits. So if they're having a great day, they don't need to overdo it where they may pay for it the next day. We see a lot of patients do that, but limit some of their activities. Other suggestions would be to eat a balanced diet, good sleep hygiene, acupressure, and acupuncture. So we need to be available to discuss alternative treatments with our patients. And as nurses, we focus on holistic care, so we are in a great position to help our patients with chronic illnesses manage their symptoms, such as with fibromyalgia. Any questions?